Here's a high blood pressure case in a 52-year-old man who came to see me a year ago. His blood pressure was consistently systolic 145 plus, diastolic 95 plus. He was under care with his primary care physician. So about 3 months in with my guidance, we put him on some dietary stuff, some supplemental stuff, and some chiropractic care. The biggest thing that made the change was the regular nutrition changes and the exercise. More on that in a minute. So in 3 months, his blood pressure went down to 120/78 from 145 plus over 95 plus. And he also had lost, as a nice thing, 15 pounds. When he met with his primary care physician, he basically told his doctor, I did no caffeine, no bread, no salt, no dairy, and I'm exercising 3 times a week. I did that for 3 months, blood pressure's down to normal. His comment by the doctor in January of 2018 was, if every patient of mine was like you, my job would be easy. That's what his doctor told him. So we've been checking in with him over this year in 2018, and here's some email exchanges here in October of 2018. His doctor told him even more. He would have just put him on high blood pressure medications had he not believed that he would be an extremist when it came to his diet and exercise regimen. Doesn't sound like that was too extreme, right? He told me, I give you 5 months to lower your blood pressure, otherwise I have no choice but to label you hypertensive and put you on medications in the system, right? Because the insurance requires me to do that. The insurance requires me to do that. Plenty of well-meaning people told this man that I take blood pressure medications and I feel fine. Don't worry about it. They are safe. So we went back and forth discussing this, and of course he's now on the rebel side, stating just some simple dietary changes and some exercise did a really good job. He just had a checkup again. Now his blood pressure checked out at 114/80. He's continuing his nutrition changes. He's doing a little bit of intermittent fasting. We'll be doing a show on that in the future. Sticking to those other simple dietary regimens, and he's exercising 3 times a week. He's now moving towards a ketotarian diet, which would be like a keto diet, but it's high in vegetables, something we can discuss in the future, which is basically something that I recommend. You can look at a paleo diet or whatever it is. I just say make it a high vegetable diet with real foods and good things are going to happen. So that's how we solved this man, just 52 years old with high blood pressure, heading towards medication, completely turned around in 3 months. I'm Dr. Scott Fuller.